Good Wednesday evening, everybody. I'm Chris Therien, former Philadelphia Flyer and current NBC pre- and post-game live for all Flyers games on NBC Sports Philadelphia. I'm joined again by another regular Flyers head trainer, Jim McCrossin. Does a great job, and we got some new guests this week. We got Dr. Matthew Brant, who is here at Recon. He's the doctor of Podiatric Medicine. Attended New York College of Podiatric Medicine. That is the New York College of Podiatric Medicine, and did his work here, his residency at Inspira Health Network in Vineland, and his specialty is really doing a lot extensively in reconstructive foot and ankle surgery. So thanks for being here, and I know that you did some stuff down in Baltimore too. We'll get to that because I have a couple daughters and I live down there. So great to have you here. And Dr. Brant did join Reconstructive Ortho in July of 2015. Great to have you here, Doc. Next guy over here is probably a lot of locals know him, Joe Crispin. I've heard his name, so that means something. Shaq and Kobe, before I tell you who he is, Shaq and Kobe actually played with him with the Lakers in 2001, 2002. Yeah, so great stuff. But he is a local, played at Pittman. Him and his brother John won the state championship in their tenure there. He went on to Penn State, where he is the all-time leading scorer, 1,986 points. We talked about that 14, but it just didn't happen. And now is the current coach at Rowan University, one of our great schools here locally in the Pittman area, Washington Township area. Joe, welcome. Thanks for being here. And a couple of a short stint in the NBA as well as a great college course. So some exciting stuff, more good guests. We are going to jump right on into it here as we get into our question. And really this week we're going to be talking a lot, as we said, about foot and ankle. Follows up, we've gone on some hip stuff, some knee stuff in the last couple of weeks, some ACL. This week is really going to be pertinent more to the basketball type of injuries that you see. And when I say that, a lot of the injuries both of you guys see as a coach now and a doctor, ankle sprains, jammed fingers, plenty of knee injuries, deep thigh contusions, facial cuts, foot fractures, and Achilles injuries, which is it goes anywhere from, I would say, the amateur level all the way through the pro level. So with that right now, ankle sprains, how prevalent are they, and how do they occur?
I'll go first with ankle sprains. How prevalent is an ankle sprain? Joe, how many times did you sprain your ankle during your career?
I lost count.
Exactly. Yeah, I mean, in the U.S. On an annual basis, it's usually about 3 million ankle injuries. 85% of those are ankle sprains. And Dr. Brant, I would probably say that you see your share of ankle sprains, correct? Yeah, with an ankle sprain, I mean, you've seen it. They can take a couple days to resolve. They can take a couple weeks to resolve. They can take a couple months to resolve. It all depends what type of ankle sprain you have. I mean, you've got your simple inversion sprain that you sprain the lateral ankle. You see it a lot in basketball, people going up, coming down and spraining it. In our sport, ice hockey, we see the syndesmosis sprain. It's when you sprain the ligaments in between the tibia and the fibula, and that takes a month of Sundays to come on.
Actually, you know what? We're on that topic right now. You talk about ankle injuries, and the one you hear a lot about, you hear about the routine. I mean, you sprain your ankle and you kind of shake it off. Sometimes ice it after the game. You get back out there the next night and away you go again. The high ankle sprain, why is that one such a much more prevalent injury, and why does it take that much longer to heal?
Yeah, so the high ankle sprain involves a syndesmosis, so it's a little different than the typical lateral ankle sprain involving. In the typical lateral ankle sprain, there's the ATF and CFL and posterior tibiotibial ligaments. So, a period of immobilization, physical therapy, most often can resolve that. But high ankle sprains involving the syndesmosis, which is a big thickening ligament between the tibia and the fibula, it's a little bit more, holds the ankle in a more stable position, and it's a little higher function than typical lateral ankle sprain. So it takes 10 to 12 weeks as opposed to, we'd say, 4 to 6 to 8 weeks for normal lateral ankle sprain.
Let me know if there's anything that comes up.
And I can attest that we've tried everything. And there's new procedures out there in terms of surgical procedures and type of procedures, but even in a skate boot where it's rigid, unlike a basketball shoe, it could take, as Dr. Brant said, it could take up to 12 weeks to fully get it back ready. But then you still have those so-called tweaks that you get. And so it does take a long time for syndesmosis sprain to heal up.
Joe, from your end, when you play with some massive human beings, is there more injuries, like in a basketball court? Do you see lower leg injuries or knee injuries from your time, especially at the professional level, when we talk about a guy like Shaq, the size of someone like that?
One of the things I used to say about ankle injuries and even knee injuries is I couldn't believe it didn't happen more often in basketball when you calculated the hours that we were on the court. From an experiential standpoint, I had more than my share, and they hurt like crazy when they first happened, but then naturally they calmed down. But probably about 5-6 years into my career, I started working more consistently with a trainer, and we did a lot of work to strengthen not only balance muscles, and I don't know all the terms, I just went through experience and getting hurt, but we did a lot of flexibility exercises for the ankle as well, using bands and different things that I hadn't done before. And I can honestly say, just in preparing more for ankle injuries over the last 5-6 years of my career, I was not as affected by them. So when you think of younger athletes or even older athletes, it's going to happen. And of course, it's like an ACL. If it's a contact ACL, well, there's nothing you can do about that. Non-contact, you should be training and trying to prevent that as much as possible. So I noticed a significant difference because I would still twist it, I'd still come down on it, but I felt like I was able to recover better because my body was prepared for it. They know how to do that better than I do, but I did notice the difference.
And you guys have the Crispin basketball program here at Total Turf. You work with players, help players learn the game, get better. How much does injury prevention become a topic for a lot of these kids?
Well, so we started when the kids are very young, and I can say that at the beginning we didn't really worry about it because they're all in elementary school, and now we have a group of kids who now they're 8th, 9th, 10th grade, and now all of a sudden it's like, whoa, step back. This is how you warm up. These are things you need to do to activate your muscles to get stronger, and now you're trying to put them in contact with people to build up their bodies a little bit because physically they can handle it. And that's one of the things that I always knew was important, but in working with young kids, you're like, they're fine, they twist an ankle, they come back in 2 minutes because they're all, 7 years old, and they just get up and they look okay. But then as they get older, well, you got to educate them on the fact that they actually have to build up their body and take better care of it. And my son's currently 14, so he's one of the older groups that we started with, and now it's a big point of emphasis for them now.
So we're going to move to the next question here, but a little bit more on the knee, switching over gears a little bit. Knee pain or patellofemoral pain. What exactly is this? When we say knee pain, what is the actual terminology? Patellofemoral pain.
You know what? Can I just add to what Joe was saying there? Because one of the pro basketball players that you heard about a lot was Steph Curry and his recurrent ankle sprains. And like Joe, he took it serious. He sought out medical help because I think Dr. Brant would attest that if you don't take care of an ankle sprain the right way, it's going to reoccur, and that's what you don't want. As an athlete, Joe and Chris, you both play sports, you don't want to do it twice. You want to take care of business. Like I always tell our guys, let's take care of business before business becomes business. But Steph Curry, he got himself hooked up with this medical guy, and he turned him on to a physio, and he changed his workout routine, right? And what he began doing is starting to strengthen his core more. Okay, so now by strengthening up the lumbo-pelvic hip complex, right, and doing neuromuscular training, he had a better awareness where he was in space, right? So he did jump up, right? He knew that, okay, he's taking more of the load off the ankles, placing it more on the hip, right? He got into yoga, he got into Pilates, right? They said that if you ever saw the airplane stance in yoga, right, he perfected that. He could do it, perfected. His hip hinge, now he was moving more at the hips instead of having to rely on his ankles, and I can explain that more to you, but he completely changed his workout routine, right, and now they're almost a thing of the past for him, which is great. Now, will they come back and bite you at some time? Yeah, Murphy can always come back and bite you, but he's doing what you're supposed to be doing, right? Taking care of yourself. Exactly what Joe said he did, 4 years into it. And so, anyway, that's my little tidbit on that.
Yeah, patellofemoral.
Yeah, patellofemoral. You see that. You see it sometimes. It's called jumper's knee. It could be pain behind the kneecap, right? It could be Osgood slaughter. But patellofemoral pain is usually what they're classifying. The patella is your kneecap. The femur is the long bone of your upper leg, right? And that patella rides up and down there. As we did in hockey, how many strides did you do during practice, right?
Yeah.
A lot. Joe, during practice, when you were playing, how many times did you jump up and down, right? And you're just pounding that joint, right? You're pounding that joint. So it's going to have some wear and tear on it. And when it has some wear and tear on it, you're going to knock off some of that articulated cartilage. It's going to cause you some grief. So what are you going to do, right? You're going to have that excessive joint pressure due to that poor patellar alignment in the femoral groove. So what are you going to look to do? You're going to do exactly what Joe said. I'm going to look to normalize or balance my muscles, right? I'm going to strengthen it. And if I don't know how to do it, I'm going to seek the right help. And that's going to your medical staff, your athletic trainers, your physical therapists, your physicians, right? Get the right help so you can take care of that and it doesn't bother you anymore because you can't stop practicing. Right? You can't, practice makes perfect. We couldn't take a day off, right? You can't take a day off. You could, your basketball player, you got to jump. Your hockey player, you got to skate, right? You can't take that day off. But there's things you can do off the court and off the ice to help minimize that discomfort.
Which will take us right to the next one, Doc, and I'm going to throw this one over you. What is, and again, we're going lower body, but knee down through ankle, and this is one you hear a lot about, but what is Achilles tendinopathy?
So Achilles tendinopathy is a thickening and scarring of a portion of the tendon. It can happen often in the distal aspect of the tendon or in an area called the watershed region of the tendon, several centimeters above the insertion. It's often from overuse or trauma or a sports injury. These are things that are best treated with immobilization immediately. A lot of times we'll put you into a camwalk or a protective boot. But a lot of times it's we get you into a proper rehab protocol to strengthen and stabilize the Achilles tendon. But it's mostly just a breakdown of the collagen fibers that make up the Achilles tendon. We get some swelling, irritation, end range, pain. A lot of times we see people who are getting back into a program, back into their sport, back into their exercise program, that they took some time off. They had a period of being sedentary, jump back into that program, the Achilles flares up. So immobilize and get to the therapist.
If I can add, please. Let's go back, was it 2 years ago, Kevin Brant? Now, obviously, teams aren't going to disclose exactly what Kevin was dealing with. But Joe, you probably seen it. You may have even had it, but some type of Achilles tendinopathy. But it's something that, like Dr. Brant was saying, you don't want to take too lightly. Nobody wants to hear a man. I really want to a camwalk, but you don't want to keep on playing and irritating. And finally, you hear a pop, right? And from what I understand, I never had one, but I've had a player that had it. They say it feels like somebody's taking a baseball bat to the back of your leg. Yeah, and giving you a whack, right? You see it in football, you saw it on the basketball court. You really don't see it in ice hockey because we don't jump that often, right? Doc probably sees it a lot. But if the doc puts you in a camwalker because you've got a tendinopathy, stay in that camwalker. Do not go out on the court to play until you get cleared.
In hockey, you're right, we don't see a lot of that. We actually have seen some really bad Achilles injuries with skate cuts, which is a little different off topic, but yeah, it does happen. But we do not suffer from chronic Achilles injuries. Joe, what's the worst, I'm going to have to ask you, what is the worst injury you've had that kept you out for a prolonged period of time?
I would say, I had to battle, I thought tendinitis with the knees and the Achilles was normal for like 6 years. And literally, I just thought it was like, I just thought that this is what you got to deal with. I look back, I'm like, I was an idiot. But, and that's one of the big pair of advice is like, it doesn't have to be normal, right? Like you can prepare and learn how to train. And I made a significant monetary investment into just learning how to build up my body in preparation for the season. And even though I went to Penn State, I didn't know how to train. So that's a big one. you know, I tell kids all the time, especially my players, there's always a fine line between tough and stupid. You can walk the line, but the moment you cross the line, you're going to be done. So you cross the line into stupid, and my career ended crossing the line into stupid in many respects. I had a sports hernia. I knew it was a sports hernia, really. I just had to do all the descriptions and everything else, and I tried to play anyway, and I busted up my whole abdomen. And then I was out for 2 months, and then I tried to play through it, and I did play through it, and then I pulled my calf muscle. And to this point, I think there's such an interconnectedness of the body that if you're trying to make up for one thing, you're going to cause a problem in another. And whether it's knee tendonitis, which I thought that was normal for 8 years. But I think the other point in all this, from an athlete's and learning perspective, is you have to learn when to stop. And I didn't learn that probably until I was about 30. It was always more is better and to work harder. Maybe I was 27, I learned it, I'll give you that. But learning when to stop and listening to your body to say, oh, wait, I got an issue here and I need to learn how to make it better. But then also I got an issue here that's chronic and I need to actually make the investment into building up my body so that I can play this game the way I should. And one of the things I learned mid-career, from the guy I worked with was, you can feel better. It doesn't have to be normal.
Yeah, and again, as athletes, pro athletes, I mean, we see a lot of different injuries that affect teams and stuff, but it's such a different world we live in now. You as a coach now, I see even my girls who are athletes as well, and my son, just the trainings is so much different. It's really professionals like yourselves that keep these kids and these athletes and these new modern day athletes up to speed, but injuries still do happen. So we're actually gonna move to the upper body. I don't think we've been on the upper body yet, but we're gonna get to it. So today I have a simple one. You're gonna see a lot of, you're handling a ball, throwing it around, you're gonna see a lot of stuff. Some of the stuff you see on the thing is a jam finger. You see a lot of that. What exactly is a jam finger? For a simple term, I don't know what it is, but go ahead.
That's what happened to my son last week when I threw him football, and I told him he didn't put his hand out the right way. But essentially, you guys can explain it better, but it's essentially any time, typically when the basketball hits that finger or that thumb in the wrong way and just pops it right into place or jams it right into place, and you get some swelling in the joint. I remember my ring finger here, I still have some. I just thought it was normal to have that joint sticking out for, again, 10 years because you just keep hitting it over and over and over. But naturally, I know these guys can weigh in more. We were always concerned, like, is it a fracture, is it not? How do you tell the difference? That's what I'd be interested in.
Yeah, and for basketball injuries, I mean, even a sensitive, a little tiny injury on your finger could be a really big deal when you have to play that kind of
The key
sport.
question, by the way, is it your shooting hand? That's always what you ask first. Is it your shooting hand? All right. If you're a basketball player, if it happens, if you're a righty and it happens on your right hand, now we're concerned. Left hand, no concern at all. All right. His was his left thumb. It's going to help his jump shot. True coach.
Just don't hurt the shooting hand.
Don't hurt the shooting hand. Protect that shooting hand.
What is a jam finger? A jam finger is, it could be anything. It could be a displacement of the plate that you have in your finger, right? Could be that when you jam it and it swells up at the joint, you sprain the ligaments, the collateral ligaments. The fingers are no different than any other joint. They have a medial collateral ligament, right, on this side, and a lateral collateral ligament on this side. And if they get sprained, they're going to bleed. And when they bleed, it's going to swell, and it's going to hurt, and it's going to take a month of Sundays for it to go away. And the best thing you can do is, I like when if somebody does get it, we don't see these much in our sport, and I know Joe does see it a lot in his sport, and I know Doc doesn't see it much in his practice at all. It may be toes, but we buddy tape. So if it's your index finger, we buddy tape it with your middle finger, right? And as long as it's not your shooting hand, you can continue to play. And I'm sure Chris is.
We did that 1 year.
Yeah.
With my hockey glove, I had the broken finger, Mickey. I had to tape them together and play the rest of the year with it.
We see our share of fractured fingers, not jammed fingers. Once in a blue moon, we may get it by somebody getting checked out with the boards, and then they come back and they jam my finger. Okay, we sprained it. It's all good. But Joe's question was how are we going to tell the difference between a jam finger and a possible fracture? Right? You're going to palpate it. I do a percussion test, and I'll show you.
Yeah.
I just do it and I do that, percussion. And if you're feeling it, it's sharp pain.
It feels like that nails on the chalkboard thing.
Yeah. But if it's a sharp pain, right, it may warrant the time to go get an x-ray. Because you know what, you want to make sure that you're not dealing with a fracture. And if we can rule the fracture out, because it's a sprain, that's good, you can go back, you can play buddy tape. If it's a fracture, it depends where it's fractured, and will it need to be fixed.
We're going to mix the last answer, and we're going to open up again to questions. And yes, Pat, we do have t-shirt giveaways. So I'd love anyone in the audience to come on up. If you have something you'd like to ask the doctor or Jim or Joe, please do. Go ahead. Yeah.
It's really for both of you, Dr. Brant and Joe. What advice would you give a youngster about helping to reduce the risk of an injury while you're playing?
Yeah, I think a lot of it comes down to just proper, getting warmed up, stretch before and after. Don't go into something cold and, just try to go out there and push as hard as you can right away. You have to kind of stretch, listen to your coach, listen to your trainer, and like I said, it's just as important to train for approprioception and balance as much as it is for speed and power. So,
one more question for you, Doc, is shoes. Like the shoe that you wear, Joe and Doc, how important is that shoe out in the court than the shoe that you're wearing every day? You see kids, it's almost like a Melba Marcos. They've got 50 different pairs of shoes, but would you recommend a good pair of shoes for the court?
Yeah, I think it depends on everything what you're doing. There's good running shoes and there's good shoes for basketball, and you want to support a sneaker. A lot of times sneakers nowadays are coming out. They're just kind of flat insoles. You'd like to find something with a good arch support to hold your joints in proper alignment, take some stress off of some ligaments and joints. But something with a higher top, you can lace up a little higher, be a little more supportive.
It's actually funny you mentioned that too, because my daughter had last 2 years of college at D1, she had bad shin splints. And these schools have the relationships with the sneaker companies, and I don't want to say what it was, but she's had to get another shoe to play this year that fits with the arch, because I think it was doing damage to her legs with those sneakers. So you have a lot of issues with that too, Joe?
Yeah, I actually tell our guys, Rowan, you can find out who we have, but I tell our guys, like, you got to wear what's good for you. Because I was beyond picky. Overseas, I got into one of my clubs because they were I forget what they were, N1 back in the day. And I told them I'm not wearing them. And of course, then they made me, and I scored 2 points. And I said, I'm averaging 20. You want me to wear them again? And they said, no, never again. Never got into that. So there's a way to get out of it. But I would also say, just as far as that is completely true, and I would affirm that. I'd also just say, work with younger kids, middle school, even the high school, just to diversify your training and diversify what sports you're playing. I always tell people it's not always good for business from a youth sports perspective, but kids should be doing multiple things, multiple sports. I tell people all the time, too often we want younger kids, even little high school kind of kids, we wanted to act like pros, and the pros want to be kids again and play multiple sports. Like, I tell people, like, I want my kid to specialize. I'm like, dude, I was 30 years old and I wanted to play softball, and I couldn't because I was a professional basketball player. Like, it's healthy to do different things. It's healthy for the body. You're moving differently. You don't even realize all the ways it helps. Even from a skill perspective, I'd argue for it. So from an injury prevention standpoint, I really do think playing different sports is the natural cross-training. And I just can't, in today's environment, because parents are so losing their minds over youth sports, like, you just can't emphasize that enough. And there comes a time to specialize, absolutely. There comes a time to put one on the pedestal, but I think we usually can be a little more patient.
I love it. It's something you don't hear a lot from a coach too. And for someone that quit the sport, I played the NHL for 12 years. I quit hockey at 14 for an entire year and played football. So
That's a great example.
it didn't make much of a difference. But anyway, it's hard to try to tell a parent that. I get it, Joe. I totally get it. All right, we got another guy. As you said, guys, with the injuries, how big is he? When you think about, is there a certain sport that you do see more injuries predominantly, Doc, in terms of what you're your main visitor would be to see you?
Yeah, I think it's a pretty solid mix. But basketball is a very common one, and a lot of times, we have people who say it's so common, coming in, you go up for a rebound, come down somebody else's shoe, roll your ankle out where they can't put weight on it. Like you said, a lot of times people come in and say they take off running and they thought a ball hit them in the back of the leg and pop their Achilles. We get stress fractures like we were talking about Kevin Durant. We get little stress fractures, non-displaced fractures in the metatarsals. We treat mobilization, sometimes surgically. But I think basketball is probably one of the most common, just with regards to ankle sprains, most common injuries.
We're going to take one or two questions. We only got a couple minutes left. If anybody has one? Anybody?
I do.
Come on up.
Yeah, come on.
Please, yes.
Chris, this is actually a question for you.
Oh, okay.
When you jammed your finger playing hockey, did you fight to overcome it?
So what I did was we were approaching the playoffs, and I had gotten slacked in the game the day before, and I kind of iced it after I had the cup on the plane on the way home. And the next day I went in and I said, something's really wrong here. And the thing was, you can still see it's all crooked now and everything. And I actually, they opened the glove, they cut the seams in the glove, put the two fingers together, and then I put it in. I used it as one finger for the rest of the year, probably like 30 games. And I think that might have been 2000, the year that we went deep in the playoffs. So you play, like Joe said, you try to find a way. You're a piece of equipment to them, and you got to try to get yourself ready to go out and do whatever it takes. It's for the fans, it's for your teammates, it's for your organization, and that's how it is. That's how it is. Great question. Yeah. So one more here. Look, you got yourself something here. Actually, we'll give it to you after because we're gonna find out the right size. So, any other questions, Pat?
What made you go into the basketball? Was there any other sports that you played that you?
That's why I often recommend playing other sports. I loved baseball as a kid. I loved it, and it was like even my senior year of high school, I got done basketball season. I committed to Penn State, and I didn't even touch a basketball for 2-3
You
months.
needed that break.
I needed it, and I look back at my career, and I probably needed it when I was playing. I burned out probably at like 24. I hit a wall, and I did not want to play basketball.
Now, did your parents push you into that, or did you choose on your own?
That is a great question too, because I tell parents all the time, and I always say that one of the best gifts my dad gave me is he didn't care. And it doesn't mean he didn't care
No, I know what
ultimately.
you mean.
He cared, but he didn't
wanted you
care.
to be happy.
Yes, if I wanted to walk away, I could walk away at any time. And if I chose baseball, I could have chosen baseball to play in college, even if it was at a lower level and it didn't matter. And I always tell people that was a gift because I drove myself crazy by myself. I didn't need any help.
No, I hear you.
Driving
I know
myself
exactly
crazy.
what
I
you
mean,
mean.
if you want to be great at something, you usually have that internal drive that sometimes can spiral out of control and drive you to just injure your body, and you just don't care. You can become impervious to it or immune to it. But yeah, I was basketball from the jump. Was probably always my favorite sport. It was number one in the house. But I did love different sports, and I did play
Was there a
different sports.
specific basketball player that you really wanted to possibly play against and meet?
So growing up, actually, my favorite player was Mark Price. Who played for the Cavs at the time. He was a scoring point guard, played at Georgia Tech, scored 2,000 in college, and that's who I wanted. That's who I
Have you ever
just-
met him?
I have not. I have talked to him through different people. I did get to play against John Stockton twice, who was my favorite, but John Stockton didn't shoot enough for me. He was more of an assist guy. I was a shooter. So I did have some good models, but I also, the way I played the game was a little bit rebellious back in 2000, but now it's kind of cool. So I can miss time that part, that's for sure.
We saw some of the greats, Michael Jordan. I had games against Gretzky and Mario games. Moments I'll never forget. Joe Crispin, who runs the Crispin Basketball Academy Center down here at Total Turf, does a great job. My girls knew who he was, so that's how famous he is. Jim McCrossin is always Flyers head trainer, and Matthew Brant, Doctor of Podiatric Medicine here at Recon. Thank you for your expert opinions to both you guys. Joe, a pleasure. We're back next week. We're going to be at 7 o'clock, I believe, right? Yeah, we got Ron Jaworski is going to be joining us next week. He'll be doing his show here at 6 first, and we will follow after. Guys, great job. Great questions. We look forward to seeing you next Wednesday. Thank you.